One. So in this video we will discuss about abducens nerve, that is our sixth cranial nerve. It is paired, and so it is also purely motor nerve. It is contain only motor fibers. And so in previous videos we have discussed about the location of motor nucleus of abducens nerve. It is in the brainstem or in the floor of the fourth ventricle. So here this is your level of your floor, means your lower pons or upper region of your floor of the fourth ventricle. So this is your floor of the fourth ventricle, this is your fourth ventricle, and nucleus is just above the superior part of your fourth ventricle or in the region of your lower pons. So here is your motor nucleus of your abducens nerve. This is the level of your motor nucleus of abducens nerve. So this is your motor nucleus of abducens nerve. So from here nucleus basically exits from that is your the sulcus, which is present between your pons and lower part of your pons and the upper part of your medulla, that is your pyramids. So basically it exits from our brain in the region of our lower part of the pons, sulcus present between the lower parts of pons and the upper portion of your pyramid of medulla. So from here the nerves comes out from the brain through basically you can say the pontomedullary junction. We can give one word for this, for the exit place from our brain. So this is your pontomedullary junction from where the abducens nerve exit from our brainstem. So the exit place for our abducens nerve is from brain is pontomedullary junction or our median sulcus. Pontomedullary we can say junction or sulcus between our medulla and pons posteriorly. So from here the nerves goes to our to the epidural sinus, that is dural venous sinus, that is your cavernous sinus, and which we have discussed earlier. Other nerves and one artery also passes through the sinus, that is ophthalmic maxillary of trigeminal nerve branch and oculomotor, and our trochlear also passes through this, and abducens, and one artery, that is your internal carotid artery. So after exiting from our cavernous sinus, it now enters our skull cavity, brain cavity. So in the skull cavity it exits from superior orbital fissure, as our oculomotor and trochlear nerve exit from the same fissure, that is so from the skull it exits from our superior orbital fissure. So it is also supplies our basically one extraocular eye muscle, that is extrinsic muscle, that is lateral rectus muscle. So after exiting from superior orbital fissure, it goes to our eye orbit, from orbit section of orbit part of our eye. So after entering the orbit, it supplies our lateral rectus muscle. This is a lateral rectus. So it's only supplies our only one muscle of the eye, that is lateral rectus muscle of the eye. So so it's basically control our abduction of the eye towards the lateral movement of our eyeball. So if any clinical occurs in this region, so there will be a problem with your lateral movement of the eye. The clinical will be your problem in abduction of your eye towards the lateral movement. So if your abducens nerve is paralyzed or any injury has occurred in your abducens nerve, so in this case, in the resting position, your eye will move towards your medial side, so you can't move it towards your lateral side. So if a person, you will diagnose, if any person you are diagnosing, if his eyes are going towards the medial side, then he has a damage in his abducens nerves. Okay, so and in some cases you can see diplopia, as same in you can see in the trochlear, also in oculomotor, maybe in oculomotor is also a clinical significance. So here diplopia can also occur. Diplopia, that is your double vision. And one more important clinical of this is your squint or strabismus. And this the person's both eyeball are not aligning in one direction. If a person is seeing his one eyeball is another direction and one eyeball is stable, but the eyeball of other eye is either towards the medial direction or towards the lateral direction. So it's not stable or aligning in one plane. So if another person is seeing his eyes, it will not, the eyeball will not be in the one aligning in a one position. So it has clinical significance, that is we called as strabismus. So these are the 3 points of important clinical points of your abducens nerve. So this is our. Thank you.